The day that the Nobel Prize for Physiology and Medicine was announced, and sometimes you hear the lessons from COVID about how COVID vaccines were developed in a year, and I think it's crucial that we just put that into the context. The COVID vaccines were not developed in a year. COVID vaccines were developed on the background, and the Nobel Prize recognises this today, on the back of work that went back into the mid-1980s. And in this period of relative short-termism in the way our political systems work, and where science just needs that continued investment over the long term, I think we've got to keep making the case, and perhaps the genetics and genomics community is one of the most important to make this case, that if you don't invest in long-term discovery science, if you don't invest in that engagement in people, in teams, in institutions, in ensuring that you don't just think about the science, but that you involve and engage the public in what you're trying to do and achieve, that you also don't think how that science might at some point be used for the betterment of health and our societies, then I think we will miss the opportunity to make the maximum impact. And we, I believe, should do that in parallel rather than sequence. That was one of the most important lessons for me during COVID, is that actually we did invest in a sustainable way over 30 or 40 years in the discovery science without really knowing where it was going to take us around mRNA technology. And then in 2020, we were able to take that science, identify it as being of use to what was needed today, and pivot it, and then in 2020 not do things in sequence, but do things in parallel, so that the science was brought to bear along with the clinical trials, along with the regulation, along with the public involvement and engagement, along with the ethics, along with the manufacturing. And it was that ability to think in parallel rather than in sequence that was so important into the speed, but it was on the background of 30 or 40 years of investment in people and institutions doing discovery science. And I think as we now move from an era of having, in some parts of the world, been able to invest in that discovery science, into an era where it is actually now already, and will increasingly in future, change our lives, then I think it's crucial to think, how do we learn some of those lessons from the last few years. And if you think of genomics and genetics, and this was something, work I was involved in, as you say, in Vietnam, but then also my time at Wellcome with entities including the international programs, but also from the Wellcome Trust Sanger Institute perspective. It's also how, and we think forward from 2023 into how that is going to change people's lives today. But if you think of the 11 years since 2011 that this organisation and consortium has existed, and then think forward another 10 years, and think what is likely to happen and try and anticipate those changes. And then, as with the way I think we need to change the way we think about things to anticipate rather than react, think what is genomics going to look like in 2023, 24, but what is it going to look like in 2030 and 20 years, and certainly in the last 20 years. And so as an organisation which is now rooted internationally, which has a very diverse set of stakeholders, and which is moving from an era in the last century from ideas into implementation, how can we bring together and bridge different disciplines to make sure that we have the maximum number of employees? Do you want me to stop? Or keep going? Keep going? Okay. Do tell me when you want me to stop. And I think that will need us in ways that I think will be quite challenging to communities, challenging within the World Health Organization as well, in reality, but certainly challenging, I think, to the scientific community, which I feel still part of, but which obviously I play a slightly different role in now. And how do we move scientific disciplines from the vertical structures that we are used to working in into more horizontal systems that put into place all of those different ologies and disciplines that we that do need to be brought together. So that genetics or neuroscience or genomics or biology or health systems or ethics and social sciences no longer seen in isolation within their own glorious isolation, but are seen as able to work together. And I suppose one of the things it would be great to talk about with you is how WHO could help play a role in that, both in allowing and facilitating and open doors, we hope, to communities that you may not otherwise reach, but also how can we broaden the scientific base from a discipline approach to a discipline plus approach that brings in other disciplines into.
Leadership in deciding this research they conduct. But having worked in a LMIC setting, I think the ministries of health would also need to be empowered with tools which enable them to prioritize different areas of research, and I would really like to suggest that as an activity that the science department or the science council takes, so that the countries would be able to produce lists of priority research which is based out of evidence and not eminence, as it were. So that is something that I'd like to suggest to you, Chairman.
Yeah, that is very... Okay, I'm sorry. Very much in our thinking. Ultimately, I don't think science exists in isolation. And lessons from many years, but including, yes, the last few, is science, how it's done within the public sphere, but also how policies are made. Many countries in the senior civil service, and indeed politicians, are not full of scientists and engineers. That's something the scientific community should address, because you can't complain about policy if you don't take part in it. But as part of this work on science, and I use that broadly, social science, engineering science, biomedical science, public health science, whatever you might say, science, research, innovation, and policy, it's critical that those go together, both because countries do need scientific advice. Countries will need scientific advice over tomorrow about how genetics and genomics works, or about how digital and data infrastructure is going, or indeed about their energy transition. So scientific advice into government is absolutely critical, and again, there are different ways of doing that, and that is very much part of this brief. But also to encourage governments, ministries of health and others, to think if we do want a strong scientific base, how would we be best advised to support that? And what templates are around the world, rather than thinking that we're the only ones doing that. Because the truth is, everyone, with a few exceptions, is thinking